So from beginning to end, a patient will see a provider. They will determine that they have HAE and that they need SAJAZIR as a rescue medication. They'll fill out our enrollment form and send it over to CycleVita. Once I get the enrollment form that's designated for my area, I input all of their information. I contact the insurance and do a benefit investigation. I find out what exactly is needed, whether a prior authorization is needed, whether their deductible has been met, or if a copay card will help cover some of that deductible, and figure out what the cost will be for the patient. And then I give a summary of benefit to the provider, letting them know all the details and what to do next, which is typically a prior authorization. We do offer patients the bridge program. So in the meantime, they are getting treatment. If they have an HAE attack, they should have rescue on hand. So we really try to be sure that no matter what, the patient is getting the treatment that they need.
Indications and important safety information. Indications. SAJAZIR, icatibant injection, is indicated for the treatment of acute attacks of hereditary angioedema, HAE, in adults 18 years of age and older. Important safety information. Warnings and precautions. Laryngeal attacks. Given the potential for airway obstruction during acute laryngeal HAE attacks, patients should be advised to seek medical attention in an appropriate healthcare facility immediately, in addition to treatment with SAJAZIR. Adverse reactions. The most commonly reported adverse reactions were injection site reactions, which occurred in almost all patients, 97%, in clinical trials. Other common adverse reactions occurring in greater than 1% of patients included pyrexia, 4%, transaminase increase, 4%, dizziness, 3%, and rash. Post-marketing experience. The following adverse reactions have been identified during post-approval use of icatibant: urticaria, drug interactions, ACE inhibitors. Icatibant is a bradykinin B2 receptor antagonist, and thereby has the potential to have a pharmacodynamic interaction with ACE inhibitors, where icatibant may attenuate the antihypertensive effect of ACE inhibitors. Clinical trials to date have excluded subjects taking ACE inhibitors. Use in specific populations. Pregnancy. Available data from published literature and the pharmacovigilance database with icatibant use in pregnant women have not identified a drug-associated risk of major birth defects, miscarriage, or adverse maternal or fetal outcomes. Lactation. The developmental and health benefits of breastfeeding should be considered along with the mother's clinical need for icatibant and any potential adverse effects on the breastfed child from icatibant or from the underlying maternal condition. Pediatric use. Safety and effectiveness in pediatric patients below the age of 18 years have not been established. Geriatric use. Elderly patients are likely to have increased systemic exposure to icatibant injection compared to younger, 18 to 45 years, patients. No dose adjustment is recommended. For more detailed information, please refer to the full prescribing information at sajazir.com/pi. To report suspected adverse reactions, contact Cycle Pharmaceuticals at 1-800-836-4380 or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.